Hey everyone, I want to talk about IBS and probiotics. It's probably one of the most common questions that I receive in regards to stomach discomfort and probiotics. Should I use them? Should I not? In this particular context, this particular person, they get worse. So their discomfort, their IBS gets worse. Now, the one of the things you have to understand is what is IBS. So I have that behind me. So IBS, irritable bowel syndrome, it's usually pain or discomfort, usually 3 times a month, and usually for 3 consecutive months. That's usually what we classify as a Rome classification. So with that, they also say that you have to have 2 of these 3 things going on. So that would be improvement with a bowel movement. So if someone has discomfort or pain and they have a bowel movement, they're like, oh, I feel so much better. Like that would be one of the qualifications, requirements. And then 2 would be onset with a change in frequency of bowel movements. And then the third one would be onset of your symptoms with a change in form of bowel movement. So the frequency of bowel movement would be, for example, I had a professional athlete who said, dude, I'm having like 4 or 5 bowel movements in the morning, and they're pretty urgent. Okay, that is not normal physiological function for your gastrointestinal tract. So that would be another sort of check mark. And then a third one, onset with the change in form of bowel movement. Now this has to do what we call the Bristol stool scale. So basically, I just explain it this way, like in the middle would be like the perfect banana. So you look in the toilet bowl and you have a brown banana in there. On one side would be constipation. So that's someone who either misses days or their poop is like rabbit poop or it looks really impacted and pretty hard to push out. And then the other spectrum would be someone who has probably, obviously, you know, it's like a faucet turning on, straight water coming out. Or it could be, you know, diarrhea-ish or even like a pile of mush. It looks like basically the poop emoji. All right. So if you have all 3 of those, then you basically have some type of IBS that's going on. But what most people don't realize is with probiotics, a lot of people think, oh, probiotics, that's going to be my cure. And that's the mentality of, oh, give me that drug or pill or give me that one solution. And unfortunately with IBS, that's only one part of what we call the 4R program. I've talked about this a lot. You can look at old videos. But remember the 4 R's. Number 1 is going to be remove. Okay. Number 2 is going to be replace. Number 3 is going to repair. And then the 4th is repopulate, which is basically the 4th is repopulate just means reintroduce good guys, which is the probiotics. But this particular person was getting worse. Their bloating was getting worse. Pain was getting worse. Well, remember, that's only one of the 4 R's. So if you don't get better with probiotics, then there's something else that's driving the issue. So that's why you have to maybe look at, it might be a remove phase. Do we remove certain foods that you're sensitive to that are inflaming your intestinal tract? Do we remove certain pathogens that have overgrown? It could be yeast, candida, strains of candida, it could be bacteria, it could be parasites. Just had someone that had all 3. It could be replace. So if you're 65 years old, most likely you're going to need hydrochloric acid. If you're 20 years old, probably not likely because you're young enough, your acid production should be pretty good. And then 3, it could be repair. So what do we need to repair? Were you someone that drinks alcohol 3 days a week, 4 days a week because you think it's healthy? Well, that's inflaming your intestinal tract. Were you eating eggs every day? That could be inflaming your intestinal tract. So there could be damage that's occurring. And then obviously the 4th one I already alluded to, which is repopulate, which is a probiotic. So at the end of the day, if you take probiotics and you're getting worse, there's something else that's driving the issue. Most likely there's some kind of overgrowth going on, and that's just putting sort of gasoline on the fire, so to speak. So hopefully this explains to you what IBS is, the context of probiotics, and where you may need to go in regard to getting further testing or investigate further and get evaluated so you can understand what is driving your problem or your gut issue. Until next time, eat well to feel well.